Okay guys, so now we are in my computer screen. What we want to be able to do now is look into who are maybe the top physician referral sources in your area, okay? Because the last thing you want to do is walk into a physician office and, waste your time, and you really understand that they do not have any patients to refer. Because is that going to happen? Of course it is, right? Or maybe you go into a physician's office and all of a sudden they say they don't have any patients to refer, or they haven't referred any patients, but then you see numbers and it says that they really do. So that means they're lying to you. So that's when you can actually prepare yourself to have an answer or how to be able to break past the objections that they're giving you. So what we're going to do is we're going to jump into the software. Let's go ahead and jump into the software. And so once again, this is a cloud-based software, meaning that you can access it to your laptop, your PC, your phone. It doesn't really matter, or your tablet, okay? So what we want to be able to do is look into and explore the physicians. So we're going to go click explore here. I'm going to click physicians. And you guys can see here is if we scroll down, it says that there are 66,753 physicians, both physicians and nurse practitioners that could potentially refer to you in the state of Texas. Right now, we have this dialed down for the state of Texas. But the truth is this, guys, let's say, for example, we are in the Dallas area. We only want to deal with Dallas area, right? And surrounding counties. Because who cares about Austin? Who cares about Corpus Christi? Who cares about San Antonio right now? You're in the Dallas area, so you want to see what's going on in Dallas, okay? So when I hit Dallas, what it's going to do now, it's now going to show me the information in Dallas. So from 66,000, now we're only dealing with 9,487, okay? Now, that's still a lot. It's still a lot, guys, right? So we can actually narrow it down even further. And how we do that is going up here and looking at specialty. So, let's say, for example, we're just going after ortho physicians. We can actually just search ortho physicians, right? And so that's when we're going to use the right marketing materials talking about ortho specialty, right? But let's just go do, just for the sake of it, let's do family practice or general practice, or let's go do geriatrics. So if I click geriatrics, for example, what ends up happening is we're down to 42. Okay, now, really most geriatric practitioners are family practitioners, so I don't really like the number 42. Okay, but if you see here though, this is the funny part. We're going to look into these numbers. Okay, physician home health agency patients. So these are the amount of, if I click information to give you guys further information, it's a number of this physician's distinct patients who are receiving home health services during the past 4 quarters, right? So by doing that, we can further down go into information here, meaning the utilization of the prior 3 months. So what utilization means percent of the physician's patients who receive home health services during the most recent 4 quarters, during the past 3 months. Okay, so looking into that, and then we're going to go into here, number of home health agencies that receives 10 or more patients treated by this physician. The reason this number is great to understand is, if a physician's only referring one patient, a month. I mean, one patient to, like, I'm sorry, not one patient per month, but is only referring to one home health agency. It's a little bit harder to compete for that physician. That means that physician kind of made up their mind that they're only going to work with that home health. So, just because they have a lot of patients to give, I'm not even going to target that. I'm going to go after physicians that are choosing between 5, anything above 5. Because if they're choosing anything above 5 home health agencies, that means their mind is not fully made up on just one preferred provider. So it's a lot easier for me to kind of go after them and convince them to try to work with us. So what we can do here is this. We're going to back up a little bit. And what we want to be able to do is, let's just go ahead and go after, let's see here. We chose geriatrics, right? So let's remove geriatrics. Let's go into, let's see here, family medicine. So if we go family medicine, it kind of increases up a little bit more to 633. And a lot of things that we teach people is that we don't want to go after 633 referral sources. You know, when we're doing a marketing strategy, a marketing campaign, we only want to go between 100, 150 places and go all out on those. Okay, so as you can see here, family practitioners, there's about 633 physicians and nurse practitioners. What we can do next is if we take out family medicine, but then we go to internal medicine, it's another choice that we want to go after. So internal medicine, now we're up to 1506. So, let's look at the, this area, right, a little bit more, because there's a lot of choices and we want to be able to narrow things down even better. So what we're going to do here is we're going to move here and physician home health patients, not physician Medicare patients, physician home health patients. The reason for that is, look, they have, like this doctor right here, Dr. Dale Davies, 357 of his patients are Medicare patients, but just because they're Medicare, that doesn't mean they are actually needing home health yet. But we know that 81 of these 357 is receiving home health. So, that's a high number. So what we're going to do here is we're going to rank it up with physicians that, has patients that received home health services. So once we click that, we find out that Dr. Tao Ho and Dr. Robert Rinkenberger are two of the top referring physicians. Dr. Tao, 819 of his 1,374 patients are receiving home health services. And Robert Rinkenberger, 615 of his 3,845 patients are receiving home health services. And next thing is Dr. Peter Davis. What's really funny here is Dr. Peter Davis, 588 patients, okay, out of his 1,091. So more than 50% of his patients is receiving what? Receiving home health. So that means Dr. Davis has a good amount of patients that are, that are senior citizens or is moving up there. But let's go a little bit further to the right here and look at some information that we want to look even further. As you guys can see here, the utilization, right, of home health services. So, Robert Rinkenberger, 16%, so let's move back here, 615 of 3,845. Moving back, utilization right here. So I would rather target any physician that has utilization of above 40%, okay? So as you guys can see here, if I had the choice, do I go after Robert or do I go after Dr. Peter Davis? I'm more going to go after Dr. Peter Davis, okay? But we'll also look at some numbers here, right? So home health agency receiving greater than 10 patients. So what we're going to find out here is Dr. Tao Ho is working between 14 home health agencies, meaning there's a mix that he's doing here. He's not just having just that one home health agency of choice. So Dr. Ho right here got my attention because he's referring to more than 5 home health agencies, because that's part of my category. You see here, Dr. Brad Pirtle, for example, he's referring only to an average to 3 home health agencies. So I would go after the 5s, anything 5 and above first, rather than going for the 3s. Even if Dr. Brad Pirtle has a lot of patients, let's move on to his right. He's got what? He's got 300 patients, but which is a good amount, okay? But he only is referring to 3 home health agencies. So nothing wrong going for Dr. Pirtle, but at the very same time I would rather go to Kevin Kim and Jamal Lone, Dr. Jamal Lone and Dr. Kevin Kim, because they are choosing between 5 or more, okay? So that's kind of one way that you guys can really look into this, okay? Now, let's just dive deep a little bit, right? So I could go into Dr. Tao Ho's or Dr. Robert Rinkenberger right now, But to make it easier for me, I want to go to Dr. Kevin Kim because he's only referring to 5 home health agencies. So let me go ahead and go into him right now. Now, one thing nice about this part is when we go to Dr. Kevin Kim, we can really do this, right? So by looking at this, I'm going to show you guys an amazing thing that we can do here. So if we go to Dr. Kevin Kim, remember we know that he has 5 or more agencies that's getting 10 patients above from him. So if I find out more, so I clicked his information to do comparisons. I'm going to do a select comparison here. We're going to see here physicians' top 5 destinations, favorites, user home health agencies. Now, we can go top 5 destinations, okay? By clicking that, we know that these are the top 5 places he's referring to. 41 patients went to Encompass Home Health. 16 went to another Encompass Home Health right here. So more likely there's 2 different territories that they have there. Texas Home Health Group of McKinley, 15 patients went to them. Homecare Patient Services, 12. And Health at Home got 12 patients. Okay, so by knowing that, we can seriously do a comparison. So when we can go after Dr. Kim and say, maybe we can do better. Moving over here, user home health agencies. So what happens here is, here we go, more information. Now let's just go ahead and use physician top 5 destinations. If I click apply, so let's add these 5, right? So we chose the 5. When we put apply, what ends up happening here is, you guys can see here, is now when we go to Dr. Kevin Kim, we actually have information for him that we can share. We say, hey doctor, you should take a look at these information that we have for you. So another thing that we can do is, hey, when we print this information for him, he's going to be able to see a comparison of this, of all the 5 agencies. Now, let's say just for the sake of it, okay, just for the sake of it, that we can look up into each one of these agencies and find out their star rating. What if our star rating was better than theirs? Then that right there makes us stand out. Another thing is here, as you can see here in the charts, is it's going to compare all 5 of the home health agencies that was chosen. Okay, moving on, same thing here. It's also going to show the rating of agency hospitalization readmission rates. So what happens is hospitalizations 90 days, hospitalizations 30 days, readmissions. Meaning that, their patients, this one right here, Encompass, 7% of their patients that got admitted to them from this doctor or from the hospital gets readmitted, right? This one's at 7.6, this one's at 12. So you can show the comparison to him about everything. And this right here, the data that you can pull up like this, you can print it out later on and share it with that physician. You can print it out in the PDF and show it to him. You can also email to him. So these are parts that you can do for your marketing strategies. So you want the opportunity to really get the information as much as possible. So right now, this is just physicians that we're targeting. In a later video, we're going to show you guys, let's say, for example, you want to target nursing homes. Let's say you want to target dialysis centers. Let's say you want to target hospitals as well. Having the data in your hand is possibly one of the most amazing strategies that you can have. Because let me ask this question. If you're a home health agency and you're watching this video right now, are you using a software like this? Do you have these type of weapons in your hands and your fingertips at this very moment that's going to be able to make you stand out? And that right there, my friends, is possibly one of the most important things that you must and you should have. You know, I spend thousands of dollars on this type of software a year, but it makes it easier for my staff. So my marketers cannot tell me that I don't provide them with as much information that they can use to be able to win, for them to be able to get more referrals. And that's what it is, because some agencies don't give these type of stuff to people, right? And you want that ability to be able to really share with them. As you guys can see here, what I'm doing here is I'm printing the information that I showed you earlier. So you can have it printed. You can have it in color. Now, just to let you guys know, since you're using graphs such as these, I truly suggest you have a colored printer. Because if you don't have that, then, you're just setting yourself short when it comes to your presentation. So because there's going to be some colors, there's going to be some graphs, you want to be able to print it that way. So I just wanted to be able to share that with you guys. So I really, really hope that this shows you guys how some agencies are winning because they have these type of softwares. Okay? And that's why they're winning. Because they are willing to invest into something like this. They are willing to do something that's more. And that's how people will win, is if they are willing to invest in them. And the people that are not investing in these, and just to let you guys know, look, it's an investment for you guys. At the very same time, yes, it's going to cost you a few $1,000s a year, but it saves you time. It allows you to have a nicer strategy. What other choice do you have? And it's a tax write-off, guys, because guess what? It is an expense. So you must be able to take advantage of this right now. If you want more information about this software, make sure you contact us. Just to let you guys know, there's 3 to 4 different softwares at this very moment that has these type of information. But I really truly prefer this particular software right here. So if you want more information, let us know. We want to be able to help you guys out. I hope this video helps you. If you guys don't mind, please make sure you like, you subscribe, and you comment down below. Have a great day, guys.